common signs and symptoms of breast cancer start from something simple as a lump. Anything abnormal that you feel on the breast tissue. There are also skin changes and color changes to the breast, the skin around the breast tissue, and also there might be changes in the nipple area as well. So when do we see a doctor? Whenever we find anything abnormal. So we are saying anything that you feel is not right with your breast tissue, let's get checked. We had rather get checked and be told that it is normal rather than just wait and maybe it's something more serious. Early detection is one of the agendas we're pushing in management of breast cancer, because we're saying when we get it earlier, we're able to deal with the symptoms earlier and actually avert the fatality cases that we're having in Kenya. Of concern right now is that breast cancer is actually the most common cancer in women right now and the third cause of death in Kenya. So it's definitely a conversation we need to be having so that we can actually avert the fatalities and avert even the complications that come with breast cancer. When we're advocating for early screening, we're looking at simple measures of self-breast examination, which we can do every month. So we're encouraging women around your menstrual cycle in your ovulation time, you can actually check the breast tissue and examine it and see if there's anything abnormal. What we have in the hospital setup, of course, we have the clinical breast exams now, which we encourage people to do annually in their annual wellness checks. So we have, for women older than 40 years, we're looking at a clinical examination every year and also a mammogram. What we currently have here is the ultrasound, which we are able to examine women less than 40 years. However, if there's higher risk of breast cancer in the family, or if you've previously had breast cancer, we'll advocate also for mammograms earlier than 40 years of age. So we are looking at 20 to 30 years old, where we're encouraging at least, there's the self-breast exam as I've talked about. Then we are encouraging at least every 3 years we can get a clinical breast examination, unless there's a high risk factor of possibility of breast cancer probably in your family line, or you've had lumps previously. For the older generation, from 30s going to the 40s, we advocate at least they can still do the self-breast exam, still get an ultrasound, breast ultrasound done every year, and a clinical self-exam done every year as well. Greater than 40 years, more than 40 years, of course, we are looking at annual checks, annual mammograms. If there's higher risk, we'll also look into other testing methods such as genetic testing, look into taking tissue samples and all that, dependent on where we are at and the risk factors and what we are presenting with. But just for screening, it's generally just the self-exam, the ultrasound, and the mammogram. So we have various risk factors for breast cancer, right from being hereditary in the family line. So if there's anyone in the family with breast cancer, it is a high risk of getting breast cancer. We have sedentary lifestyle, which is related to obesity, and of course eating the unnatural processed foods that we are having in this day and age. The other risk factors, smoking is a risk factor in every form of cancer. Of course, drug abuse and excessive alcohol use as well is a risk factor. Stress has been related to many cancers because, of course, it lowers down your immunity and your body is more prone to basically getting unwell. Yeah, so it's one on the bottom of the line. We're still looking at stress. Yeah. So also excessive exposure to estrogen hormone is one of the major causes of breast cancer. And it's attributed to early menses that we are noticing in this generation, and also late menopause, and also hormonal therapies that make you more exposed to estrogen. So also family planning, the combined pills also have excessive estrogen. So anything that makes you prone to excessive estrogen in your body, in duration, in numbers of years as well, and just excessive exposure in that duration makes you at high risk of having breast cancer. So prevention of breast cancer comes from simple things such as exercise, eating the right foods, foods that are have antioxidants in them, such as fruits and vegetables, avoiding processed foods, managing stress, and of course less exposure to estrogen. So maybe avoiding things such as contraceptives that are high in estrogen, and hormonal therapy in menopause stage. So these are some of the things that we can do to avoid breast cancer. And of course, early screening is always a major thing. So how does exercise, we may ask, how does exercise help in reducing breast cancer? Remember, with exercise comes reduced calories in the body. So definitely if we are working out, having an active lifestyle, we have less fat deposits in our body, and it's been related to lowering risks in most of the diseases and even breast cancer as well. Eating the right foods, definitely. We've talked about foods with high with antioxidants that actually remove any toxins, just help the body remove anything that is not right in the body. So we're looking at things such as green leafy vegetables, we're looking at tomatoes, lettuce, broccoli, taking, and of course also just hydration in itself, at least your 2 to 3 liters of water a day. So basically anything natural is better than the processed foods. When you have a high risk of breast cancer in the family, there's genetic counseling and testing that is being done where we check for certain genes called the BRCA1 and 2. It can be checked both in men and women because men are also at risk of breast cancer, not as common, but they also do get it. So what happens, a genetic counselor is able to take you through and give you the different possibilities that you would get, because it might turn out positive, it might turn out negative. So if it turns out positive and you have a family history, it doesn't mean you're going to get cancer, but it just means that you can actually put put in the back of your head that I need to be doing preventive measures. So you need to be healthy, living in the right way, eating the right foods, exercising and all that. And also having a negative test doesn't mean you will not get. So it's not guaranteed that if you find it earlier that you definitely are going to get cancer. So this testing, we look at it being done from the age of 20 if there's that high risk of getting breast cancer in the family. And what they take is a sample of blood or saliva, and it's checked out. Now this gene will probably also give you be able to help you in diagnosis of screening of other cancers such as the pancreatic cancer and prostate cancer as well. So it just doesn't do for the breast cancer as well.